So our goal was to look at the impact of giving kids calorie information and what effect does it have on their purchase of sugary beverages or sugar-sweetened beverages in corner stores in Baltimore City. And the reason for this was threefold. We know that adolescents, particularly black adolescents, are at higher risk for obesity. We know that calories consumed in liquid form tend to not be well compensated for, meaning that if you drink calories, you tend to not eat less solid food because of it. And we also know that in general, Americans have low numeracy, so they're not good at changing numbers around, and low literacy skills when it comes to calories. And so we thought that if we can give them calorie information in a way that's not just absolute calories, meaning a hamburger has 250 calories, maybe it would have an impact on the choices that they make. So we chose 3 different types, and one of the big reasons that we chose calorie information in the first place is that part of health reform, they mandated that if you're a chain restaurant with more than 20 outlets, you have to post calorie information on menus alongside price. So we tested 3 different types of calorie messages, which we randomized in the stores. So they were one at a time, posted on beverage cases. So an adolescent would walk into the corner store, there'd be a bank of soda beverage cases in front of them, and there'd be signs posted on every beverage case. And so one set of signs said, a bottle of soda has about 250 calories, which is the current standard. So you walk into McDonald's and it says a hamburger has 200 calories. The second sign said, a bottle of soda is equivalent to about 11% of your total recommended daily intake. And the third sign said a bottle of soda is equivalent to about 50 minutes of running. And we tested all those signs to see what effect does that information have on purchases of sugar-sweetened beverages. So the results were really encouraging when we found that providing adolescents with any information relative to none, so any of those 3 signs that I described, reduced the likelihood that they would buy a sugary beverage by 40%. And then of those 3 signs, the one that was most effective was the physical activity equivalent, or telling the adolescents that a bottle of soda is about 50 minutes of jogging. And we found that when that sign was posted, the likelihood that they would buy a sugary beverage reduced by about 50%.